And good morning, I'm Dr. Deuk Majan. I'm here with one of my lovely patients who came back to Florida to visit us after he underwent surgery with the DPR, Deuk plasma rhizotomy, and the DLDR, right?
That's correct. We're going to talk about both.
That was 8 months ago, almost to the date, just a little bit past. He wants to share his story, so I'm going to let him talk.
I got to tell everybody that when you watch Dr. Deuk, he's the real McCoy. He's very serious. He's in a very serious business. He wants to heal people and help people. He's very goal-oriented. He demonstrates that, and his employees are the same way. That I was a very tough case, probably one of his tougher ones that you had. I remember the time. He didn't believe me, but afterwards I was. But he was very helpful. I didn't have a lot of pain, and I was unique from the standpoint that I had a lot of arm weakness. Within minutes of doing our Zoom telehealth, Dr. Deuk says, you know, your MRI isn't bad. I treated a lot worse MRIs than you. And he says, but I don't treat the MRI, I treat the patient. But I think you have a brachial plexus issue, which is your nerves in your arm. It didn't really register with me, and nor my people that were supporting me at home. Now that I've had the surgery done, guess what? Dr. Deuk, you were correct. I have a brachial plexus issue. I mean, before the surgery, my hand grip was maybe 60 pounds. Now it's 128 pounds.
Yeah, you almost broke my hand shaking it.
Yeah, I didn't want to break his hand because he needs to help more people with that hand. But I do have a lot of still issues in there, and I am working hard with my physical therapy and what have you, and trying different things to improve it, to keep moving. And I still remember him saying to me, he says, you know, this is going to be a marathon, not a sprint recovery. I don't want you yelling at me in a year that you're not totally recovered. I'm making progress. I want to come and thank Dr. Deuk for doing that, and I am happy that I came here. And on top of it, then Dr. Deuk, I baited him in during the end of one of his surgeries when he was taking the questions and answers, when he was talking about his DPRs. I asked him, did you ever do a DPR on your thumb, on a basal joint? And I could just see the light bulb going off in his head, and he got the smile on his face like, no, but if you come down, I'll do it. And we did do it. And I'll have to say, being the first, I have a basal joint issue, arthritis in the thumb. It's back to normal again. Not a problem. Mission accomplished.
So you had the cervical surgery, but we also fixed your thumb with the Deuk plasma rhizotomy, the arthritis pain. And where did you guys come from to get the surgery?
Massachusetts, western part of Massachusetts.
How'd you hear about Deuk Spine Institute?
I heard about Deuk by just searching the web and looking. I originally diagnosed with my cervical issue by the local doctor, who I have a lot of respect for and know a lot of people who've been through him and had surgeries by him. He basically said it's an ACDF, and I just did not want metal in my neck. I went on a mission, and I found Dr. Deuk here at the Deuk Spine. After watching more videos than he says in the surgery, I've watched probably 20 or 30 live videos, cervical surgeries, as well as that many probably recorded, because I really wanted to find out what I had in common with the people that he was working on and how they responded to the surgery.
Are you happy with your results?
Yes, sir. 100%.
Anything else you want to tell the crowd?
Well, I do have one thing, and I mentioned this in one of the telehealths that we did after surgery, that I have a new name for Dr. Deuk. And if anybody would want to comment, here it comes, that Dr. Deuk are no longer is considered Dr. Deuk. The new name for Dr. Deuk is Dr. Light Switch, because he turns off the pain. I didn't have a lot of pain in my arm. I had a lot of pain in my thumb, and the DPR turned off the pain. I think this is no longer the Deuk Spine Institute, it's the Light Switch Institute, and this is Dr. Light Switch.
Thank you so much. So DPR of the thumb, you're the first patient, and it worked. We're very proud that it's working and very happy for you. Congratulations.
Thank you.
Come here, my friend.
Hey.
Now go and enjoy life, okay?
Let me squeeze your hand one more time, man.
Yeah.
There you go.
Yeah, iron grip.